In this OPG series, I will be sharing with you why you need an OPG for all your diagnosis in every type of case inside your clinic. And today we'll be starting with the basic landmarks first and how to read an OPG file quickly. Then I will be telling you about the specific case details of this particular patient. So when you start reading an OPG file, first you start with the right and left side. R marks the right side, L marks the left side of the OPG. This helps you clinically correlate the picture with the actual scenario. Then you move on to reading the OPG file and you quickly take a brief scan to analyze the number of teeth that are there and the health of all the teeth that are there inside the mouth. You also start with reading the bony structures that you see here. First is the mandible, which is the most prominent part of. If I quickly zoom in here and I will show you. Now this is the ramus of the mandible. This is the peripheral border over here, the external and internal one. This that you see is the angle of the mandible. This is the condylar process and the coronoid process. Let's zoom out a bit and then we move towards the center of the OPG. Here that you see is the body of mandible and the external outline looks absolutely fine. It is completely intact. Then if you see here, this is the inferior alveolar nerve bundle that runs along, and here is the mental foramen where it takes an exit. Similarly, on the opposite left side, you can see this is the path of inferior alveolar nerve bundle. Next, in the maxillary structures, this line that you see is the hard palate. This is the nasal septum over here. You can also sometimes see a soft shadow of the soft palate. After all of the bony landmarks, now you move towards reading the teeth that are there. If you see the number of teeth in this particular case, moving towards the center, this is an extra tooth. It's a retained deciduous, and let me show you why we can identify it as a deciduous tooth. Like you can see, the root seems shorter. The tooth crown length is also shorter. And here, if you identify the number of teeth, this is the central incisor, lateral and canine. Similarly, central, lateral and canine. So there was a midline retained deciduous teeth over here. Now let's zoom out and move to the other side. On the left side, you can see this patient presented with the chief complaint of pain on the lower left back region. And here, as we can very clearly see, there is a radiolucency in the enamel as well as dentine that extends very closely towards the pulpal area. This was causing him pain. But unrelated findings that we can see here is this again a previous restoration that had been done. Slight halo of radiolucency as well as a shadow that is marked over here. And on the opposite side, the major finding over here is that there was an old root canal treatment that was done for the patient, and there is a big apical radiolucency that has involved completely all of the periapical bone, the periodontal ligament, and this shadow is completely taking over the furcation level as well. The maxillary teeth particularly seem relatively fine. There is no absolute finding in the maxillary teeth. So that's all about this case, and if you want to know how we treated this tooth, please comment down below treatment and stay tuned for part 2 of this video.